Good morning, everyone. The policy we will be debating today is to strengthen and improve SNAP. Alexis and Bianca will be arguing for the policy, and Lori and Kylie will be arguing against it. Now to introduce the policy. Supplemental Nutrition Assistance Program, also known as SNAP or originally food stamps, is the country's most important food safety net program. It is a federal food assistance program with the mission to increase food security and reduce hunger by providing children and low-income people access to food, a healthful diet, and nutrition education. SNAP provides temporary benefits in the form of a credit or an EBT card. Prior to the COVID pandemic, 37 million people in the US were food insecure, and now an additional 17 million people may face food insecurity as well this year. The Academy of Nutrition and Dietetics and the American Medical Association jointly urges Congress to support efforts to strengthen and improve SNAP and help Americans to keep food on the table. The Consolidation Appropriations Act of 2021, signed by President Donald J. Trump on December 27, 2020, increases Supplemental Nutrition Assistance Program, or SNAP, by raising maximum allotments to 115% of the June 2020 value of the Thrifty Food Plan. This provides the revised maximum SNAP allotment amounts by household size for the 48 states and DC, Alaska, Hawaii, Guam, and the Virgin Islands. This policy will take effect on January 1st, 2021, and it will go until June 30th, 2021. Now that I have introduced what the policy says, I will go ahead and make my points for the pro side. Some families do not have the adequate resources to purchase the amount of food that they need to maintain an active, healthy lifestyle. Therefore, increasing SNAP benefits for families would ensure more Americans have access to nutritious foods and address health inequities. In addition to this, an increase in SNAP would also provide funding that is instantly returned into the economy in support of local businesses and agriculture, which will be discussed a little bit later. Minority groups, as stated by President Linda of the Academy, minority groups are being hospitalized and dying from the virus at much higher rates than white people. She also states that food insecurity is a risk factor for negative psychological and health outcomes, and it increases the risk and severity of diet-related diseases. The Academy and the AMA note that marginalized and minoritized populations are already up against odds. They were more likely to experience food insecurity, which is a lack of access to sufficient quantities of affordable and nutritious foods. These populations have long faced chronic disease disparities due to socioeconomic inequalities and reduced access to healthcare, healthful foods, and safe places to be active around their community, as well as safe parks. The AMA president, Susan R. Bailey, states that investment in SNAP has been shown to reduce food insecurity, healthcare utilization, and costs, all while improving health outcomes. She also states, on average, adults participating in SNAP incur a 25% reduction in healthcare costs compared to their non-participating counterparts over a 12-month period. Therefore, an increase in SNAP will further these healthcare savings. SNAP is important for children because it helps with the development of children and helps them to succeed academically. Research finds that young children whose families consistently receive SNAP are likelier to have regular access to food, to be in good health, and are at lower risk of developmental delays than young children in households that have lost part or all of their SNAP benefits in general. SNAP, not only, as mentioned before, not only does it increasing SNAP help American families put food on the table, but it also helps to put food back into the economy. Each dollar in federally funded SNAP benefits generates $1.79 into economic activity. And that concludes the end of my argument for the pro side.
I'd like to first thank my colleagues for explaining how SNAP works, but I think you may have forgotten two key words within the acronym that is SNAP, and that is supplemental and assistance. This program is utilized to supplement participants' income and assist them in dire time of need so that they are able to purchase healthy and nutritious foods. This program is not meant to be utilized as a sole source of food, nor used for a long period of time. The reason why this is a supplemental program is because we know that there are community-based organizations that are better equipped with local demand and changing needs, especially during a pandemic. They know better than anyone what is best for their community, where their food deserts are located, and where the most need should be allocated. For example, we'll look at our neighbor, Texas. H-E-B, Texas's largest grocery chain, teamed up with Capital Metro, which is their public transportation, as well as a Central Texas food bank to provide relief for older adults and individuals with disabilities by delivering help at home kits, which were filled with shelf-stable items and other pantry staples. H-E-B donated $150,000 to this effort in March of 2020, which came on the heels of H-E-B's $1.2 million investment to Feeding Texas and delivery of a trailer of food to the Central Texas Food Bank. In 2018 alone, H-E-B's Food Bank Assistance Program donated more than 32 million pounds of food to Texas and Mexico food banks, which equals to over 25 million meals. H-E-B continues to partner with food banks all over Texas to help further their growth, their mission, and ensure more Texans have access to food. Even in their stores, customers can easily donate directly to the Central Texas Food Bank by pulling off a small $1, $3, or $5 donation sheet of paper whenever they check out and add it to their grocery list. Because of this sustained partnership, the food banks have flourished in Texas and have been able to reach more of those in need. So as you can see, this is an example of state and local government being better suited for a particular task and immediate response. We believe it is for the betterment of American citizens to combine a local and federal approach without increasing the federal debt by increasing federal spending on this particular issue. Increasing SNAP dollars simply puts a Band-Aid on a progressing issue where money could be utilized to help build back the foundation of the economy, where other programs and organizations can instead step in and step up to fill this unfortunate financial gap. For instance, American citizens are continuing to line up at food banks all across the nation in order to gain access to healthy and nutritious foods to feed their families, and those numbers are only increasing. Food banks act as a logistics arm for a swath of hunger relief programs, overseeing supply chains that connect donations to those in need. They work to recover surplus food from supermarkets, manufacturers, farmers, and government agencies, and then ship, store, and distribute that food to smaller agencies like food pantries and meal programs. According to Feeding America, from the beginning of March through October, food banks nationwide distributed an estimated 4.2 billion meals to neighbors facing hunger in the US. These 4.2 billion meals are just enough to provide every single resident in the United States with breakfast, lunch, and dinner for just over 4 days. There has been a tremendous increase in the amount of people visiting food banks, and in most cases, some people are visiting for the very first time. Just in March through June of 2020, 4 out of 10 people visiting food banks were there for the first time. More than 80% of food banks are serving more people now than they did a year ago, and as layoffs and business closures have affected the incomes of many Americans, food banks have distributed 50% more food than they did last year at the same time. This just shows how much food banks have acclimated to a higher level of need and have heeded the call of their community. With help from donations from other caring citizens and monetary and physical donations from the private sector, food banks have been more than successful with ensuring people in need have direct access to food. We understand this is a hard time for everyone, especially during a pandemic. The US government has acted swiftly to deploy vaccines and sent out the second round of stimulus checks to help bridge this gap. People have lost their jobs, and America is going through one of the toughest times it ever has. During a time of limited federal resources, we must spend each dollar in the most effective way to combat this pandemic to meet the needs of the people. We can better spend government time and our taxpayer dollars for efforts like increasing the minimum wage to where individuals should not have to rely on government assistance. According to the Center on Budget and Policy Priorities, low-paying jobs without key benefits actually contribute to income volatility and job turnover. Many of these hardworking individuals rely on SNAP, as well as depend on it when they are in between jobs, thus creating a cycle until the time comes where these workers receive higher pay and crucial benefits like health care and sick leave. With this in mind, there is a danger of creating a permanent culture of poverty as inescapable as any chain or bond, a second and separate America that remains in cyclic poverty. This is all to be said, instead of constantly increasing benefits to SNAP, the federal government response should be focused on bigger issues to lay a foundation for Americans to not just survive, but thrive for the long haul. And that concludes my side.
Thank you, Lori. I will now be presenting my pro side of that. I totally agree with your side of what you were saying about looking for local food banks and such. However, if you know that SNAP has helped 20 million children, and half of those recipients from SNAP are from children, about 44% of them. And in 2015, 6.1 million children under 5 received SNAP, and 8.3 million children between the age of 5 and 11 also received SNAP. Children in poverty exhibit an unreadiness for school because it leads to poor physical health and motor skills. This decreases their ability to concentrate and remember information, and it shortens their attention span and decreases their curiosity and motivation. One study showed that a reduction in food intake can reduce their brain's ability to learn. So access to adequate health diets during early children is essential to developing the skills necessary for the school success, including memory, emotional stability, and social skills. SNAP participates can lead to improvement in readiness and mathematics skills and among elementary children, especially young girls, and increases the chance of graduating from high school. So all in all, it has helped with the education part and helping children's concentrate. However, economically, it also has been beneficial for the economy because household participants in SNAP will spend more on that food by providing more resources for food. SNAP helps free up cash for poor households to buy other essentials like diapers and medication. As a result, in retail increase, benefiting stores that sell both food and non-food items. On top of the pandemic, this year, we also had to worry in Louisiana about hurricanes. And because of that, many families went hungry. And so there was a hurricane relief package that included approving those for SNAP to give extra money to those families who've lost a lot during the hurricanes. And not only has that helped with that, but you did mention something about the food banks, and I would mention that with food banks, there's sometimes not adequate nutritious food there. So, and most of them are due to donation based, meaning they might not have all the equipment that those family needs to prepare a food. So SNAP gives that liberty to families to choose whatever they want from the local stores, and according to their preference, their taste, and nutritional needs. And at the same time, it decreases the food insecurity by not restricting them to buying certain items. Many who no longer qualify for the pandemic benefits or unemployment can also rely on SNAP benefits to help them to struggle and recover from the financial burdens that this year has brought them. And that concludes my points from this side.